The first compensatory strategy I will be talking about is postural treatment strategies. Before I start talking about the different postural strategies we can implement with our patients, why do we implement postural strategies? And it's to prevent aspiration. So, what is aspiration? Aspiration occurs when the food or saliva enters the subglottis. There are three types of aspiration. Aspiration before swallowing reflex is engaged, aspiration that occurs during reflex, and aspiration after swallowing reflex is completed. It is not easy to completely prevent aspiration in patients with dysphagia. However, there are cases where aspiration can be minimized through different postural techniques. So, postural techniques redirect the movement of the bolus in the oral cavity and the pharynx and modify pharyngeal dimensions in systematic ways. Postural techniques may be appropriate to use with patients with neurological impairments, head and neck cancer, and other structural damages. Um, Posture techniques may be used in patients of all ages, and some of the postural techniques are chin down posture. The chin is tucked down toward during the swallow, which may bring the tongue base closer to the posterior pharyngeal wall, narrow the opening to the airway, and widen the valvular space. Head rotation is when you turn to the side. The head is usually turned either to the left or the right side, typically toward the damaged or the weak side to direct the bolus to the stronger of the lateral channels of the pharynx. Head tilt, the head is tilted toward the strong side to keep the food on the chewing surface. So how does it work? Chin down posture keeps bolus in the anterior oral cavity, preventing premature spillage. Widens the valvuli to accommodate bolus prior to swallowing response when delayed. Flexes epiglottis into more protective positions over the laryngeal entryway. Narrows the laryngeal entryway, reduced tongue base to posterior pharyngeal wall distance. Head rotation channels bolus down the stronger side by closing off the weaker side preformed sinus, increases vocal fold closure through the external pressure on the thyroid cartilage. The head tilt channels the bolus down on the stronger side using gravity. So why do it and what problem will it address? The chin down posture, it will address oral control problems, premature loss of bolus, delayed swallow response, and reduced airway protection. The chin tuck will address the oral control problems, and the head tilt will address unilateral pharyngeal paralysis. Postural technique importance. Why is it important to address postural techniques? Aspiration is one of the most serious problems for patients with dysphagia. Preventing aspiration requires both the effort to minimize aspiration and the techniques to provide onset, even if the patient experiences aspiration. To accomplish this, body positions are adjusted and the form of food is modified, and training and oral care is provided. Thank you.